Very good point, and that's something that I'd planned to address before we were done here. The question that she had, she was telling the story that she had been a previous patient of ours, and she had done quite well with the treatment for about 2 years. And so that's great, and I thank you for sharing that. So if you want to talk to somebody about our professionalism and how we work in the office, I think she can vouch for that. But as I said before, these things, we treated her, we got her better, but it lasted for about 2 years because it didn't regenerate anything. So the next question she had was talking about her insurance. So she brings up a good point, and a point that I always address during this lecture. Is stem cell treatment covered by insurance? The answer to that is no, it's not. Okay. What is the typical cost? Well, it's not cheap. It's going to range somewhere depending on the condition that you have, the severity of the condition that you have, the number of conditions that you may have. If you have more than one that needs treating, the range is somewhere between $3,000 and $12,000. Okay, so will insurance begin to cover it at some point? I don't know, but here's what I do know. In the last year, we went from 200 clinics in the United States performing stem cell treatment to 880. So that's still not a whole lot. But the projection is, we're in 2000, rounding up, coming into 2018, the projection is by 2020 that number is going to be 25 times fold. So, you have to ask yourself this question, and I'm just being completely straightforward with you. As the popularity of stem cell therapy grows and grows and becomes more popular, the number of donor cells that are available to all of us, simple supply and demand, is going to diminish. So what do you think is going to happen for the mothers that were once donating to science when the supply gets high enough? Now they're going to be selling it. And so when they start selling it instead of donating it, what do you think the cost is going to be? It's going to go up. And so I really try to impress upon the fact, those of you that, even if you're just here and you're considering it, you might want to take a step back and consider it a little more seriously and really look at the whole picture. And, this is the time, because I really feel like, I don't think you're going to be sitting here in 2 years thinking, well, I'll wait for insurance. I don't see it happening, because insurance is not getting better, folks. It's getting worse. And just like you mentioned, you get 3 visits. We have people come in all the time. They've got a herniated disc. Well, you got to pre-certify to get 3 visits. How am I going to treat somebody with 3 visits to do something that's severe? You can't. And so insurance is getting worse. Deductibles are getting higher. The responsibility is being passed on to us, the patient. And that's just the way it is. So I don't foresee that insurance is going to be a lot of help for us. And if it is, that would be great. But Medicare is going broke, and it's just not available. So I see it in our practice every day. The same procedures that I got paid $100 on last year, I get paid $30 on this year. When you lose 70% of actual reimbursement from third-party payers in a year, you know that things are not getting better, they're getting worse. And we see it year after year after year. So I really want to impress upon you, and I don't do this to be, I'm not a high-pressure kind of person, but I do like to help people, and I like people to have an opportunity. And even though $3,000 to $12,000, depending on where you're at in that range, is a lot of money, it's not anywhere close to where it is if you go outside of the United States, and it's not anywhere close to where it's going to be a year or two down the road. I really believe we've got about an 18-month, 24-month window. Before that, 3 to 10 is more like 15 to 25. And then after that, it's going to continue to go up because the demand is going to go higher. Okay? Now, what I hope happens is that at some point we start to have an understanding that this is a better option than replacement or orthopedic surgery, and the insurance will start to shift some of that cost to you. But insurance does things that just don't make sense to me sometimes. So I can't bet that that's going to happen. And, if I'm in your situation, I've got to be thinking this is the time now that it's more affordable. But that's a great question. And unfortunately, that is true. But you also have to think to yourself, what's my quality of life worth? Because I see people all the time that'll go buy this or they'll go buy that. It has nothing to do with their quality of life. And then they look at something that for their health that says, well, that's a lot of money. But I know people that drive vehicles that cost over $50,000 a year. But they think that treating themselves for $3,000 or $4,000 is a lot of money. It blows my mind because that's, regardless of how nice that vehicle is, it's still just a motor and some metal and some wheels and taking you to and from. Yeah, I would rather, this is just me, not everybody has the same opinion. I've seen people suffer with their health because they would rather drive a nice car than be healthy, viably healthy. Doesn't make sense to me, but hey, to each his own. But for me, I'm going to spend my resources, at least some of them, on taking care of myself, just like I did my knee with my torn ACL. I didn't want to, it wasn't the fact that I couldn't go have an ACL surgery done. It's the fact that I didn't want to be out for 3 or 4 months. Okay, football season's coming up. I like to go to Neyland Stadium, walk up them steps and yell and scream and all those things. That's important to me. And if I have an ACL surgery, I can't do that. I can't work if I do that. Okay, I couldn't stand here. I guess I could sit down and do this lecture. Anyway, okay. Any questions here? Yes, ma'am.
3 to 10,000 for one injection?
3 to 12 is typical range.
One injection?
Yes, that's correct.
Just
Yep, that's correct.
outpatient?
It is outpatient. No anesthesia, no surgery, no downtime. It's actually a 2-step procedure. We actually, the kind of process goes like this. Patient, if you decide to come in, you'll come in. We'll take a medical history, find out, everything A to Z, all of the medications you're on, all your past procedures. We'll do a physical, orthopedic, neurological exam, determine what the integrity of the situation of the joint is, any diagnostic imaging that's needed, x-rays, MRIs, all those things are covered under your insurance. And then if you are a candidate and you choose to move forward, then the injection procedure is usually 2 steps. One is called an accelerated GF injection. That's actually, anybody ever heard of platelet-rich plasma?
Yeah.
Okay, so it's an advanced form of that where we draw your blood, we send it to our lab, we spin it down, we take all of the cytokines and growth factors out of your own